Hey everybody, it's Eric Dinkins with Mulligan Concept Teachers Association, and today's topic on our quick hitters are going to be what to do next when we've already found some success with mobilization with movements in the clinic. So as an experiment, I've been working with Mark here, and he had a loss of right rotation cervical motion. That brought on some right regional pain over here. And I also noticed on some testing that when his arms came up overhead, he had a little bit of loss of end range motion forward elevation, but it wasn't symptomatic. The left side was fine. So we decided to do some reverse snags at the CT junction. Maybe we did some snags at the cervical spine, and now we have full range there. So I have a couple options for home. I can just send him home with cervical rotation, with some overpressures. Maybe that's with manual or just with breathing and exhalation. Or I can do some complementary things, and here are some things that I typically will use in clinic. So let's go ahead and face the wall. If I get his arms up overhead, I'm thinking I need to create some type of mobility or motion out of the CT junction. So I can oftentimes get a person to extend, as long as that wasn't symptomatic, by looking up toward their hands. That's going to start getting some development of motion at the CT junction, maybe a little bit lower. And then he's going to do a lift off, keeping that elbow straight on the right side, okay? Making sure that doesn't cheat over there, and he can do unilateral or bilateral. I don't care with this activity, okay? He can have his thumbs back, he can have palm down depending on what he can do. He can even bring in a little bit tighter motion if he needs to and go ahead and do another lift off through there. Perfect. Engaging those parascapulars through here, getting that mobility through the CT junction, and come back down, maybe go through a set or two of 10, and then make sure that that's well tolerated and they maintain their in-range cervical motion that we had just gotten back before. So this can be a nice complementary exercise to the comparable sign that you were treating for neck motion. Hope this really helps, and I hope to see you at a course in the future.